Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin Hung. The world of technology and healthcare ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be talking about the recent survey results from the Sway Health survey to learn about the health IT media by the numbers. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 18 years of health IT blog content at healthcareittoday.com. Do you subscribe specifically to certain publications? It's interesting, this evolution of media, right? Like, we used to be like, oh, the paper showed up and I read it every day, right? Like, I don't. I really am, like, social media is how I read. And so I read like 100 different publications, but all from social media.
I still am old school. I still rely on the newsletter, as well as social. But yeah, I still subscribe to all of our peers, and I actually enjoy their coverage. We all have different perspectives. We all cover different things, and so it's nice. And I also enjoy just kind of reading it all, like just the headlines, right? Just all compact in a newsletter. So I still subscribe to quite a number of newsletters, probably about 20.
Yeah, it's interesting how consumption patterns will continue to change, right? I mean, even coming out of our Sway Health conference that just finished as we're recording this, it was interesting to hear some people say, "Oh, well, how will that consumption pattern continue to change with AI?" When I just say summarize it, like
Yeah.
you can literally tell AI, "Hey, summarize the articles for this week," which is a fascinating and somewhat scary thing for some people.
Including for us in the media, that's for sure.
Well, but I think many people, though, will say summarize it, but include the links. So if they like it, then they are going to click through, right? So we probably will still get some of the clicks, if it's a topic that, so in some ways it could become a new distribution source, which is fascinating.
So John, let me ask you this question. Based on the numbers that we presented at Sway, do you think we're tired? Are we finally tired of talking about AI in healthcare?
Well, as you said, the numbers that you presented at Sway Health definitely say that the health IT media is still writing about AI. It's still the most popular. I thought it was fascinating how you compared it to COVID, and it didn't overcome all of the news media, the health IT media, the way COVID did, which I think was interesting to note. But I would say we're not tired of talking about AI. As, health IT leaders want to hear about AI. What they may be tired of, and probably not even in May, they are tired of, is hearing that AI is going to change XYZ in healthcare, right? Like, they don't want to hear that it's going to, or that it could, or look at the potential of AI to do something. They want to know, like, what actionable things are actually happening with AI that are improving the healthcare organizations that they should actually consider implementing in theirs. So I think they're done with the minutia of AI and the potential of AI, and maybe even to some degree the ethics, although that one may last a little longer. The ethics and health equity concerns, that those ones may last a little longer, but they really want to get to the real solutions that are making a difference.
I agree. I think people are tired of hearing about AI in theory. And I
Yeah.
think what people are really wanting now is AI and practical AI. Like, how can I use it? Where can it be used? Who's been successful using it or not successful, as the case may be, because they want to do something similar and something meaningful in their own organizations. It is interesting you mentioned. I did the comparison to COVID just because I was curious. So just for the sake of the folks that don't have the numbers, when we did the analysis, it ended up that AI ended up anywhere between 8 to 10% of all the headlines over the past 3 months in healthcare media, which is a lot, but still nothing compared to the 30 to 40% at the height of COVID. Like, that every other headline basically was COVID. And you can understand why, right? I mean, COVID was a worldwide phenomenon, a worldwide issue. versus AI in healthcare, which is very, very niche. And, we have a lot of other topics that were also taking time from the headlines, like cybersecurity and data breaches and those kinds of things. So, but yeah, I don't think people are tired of hearing it. I do think, though, that we have to be a little bit more selective as media on what we cover with AI because I think people are just, yeah, they're tired of hearing the hype. They want the real stuff.
Well, and I think most of these leaders are a little overwhelmed by what am I supposed to do with AI, right? Like because they don't want to get behind, right? Like they want to find these solutions that are actually working. So I mean, I think there are some that are interesting. For example, is AI potentially going to be a great solution for ambient clinical voice? We're starting to see that roll out where it is real, right? We're seeing it applied to faxes. There's all these incoming faxes and taking them and helping them to sort them and identify who is the actual patient with them that's going to be able to do it. So I think that's interesting as well. I think some of the other AIs, in the responding to patients, that's become real, as we've been inundated with patient messages in our inbox, that's become a real thing. And so I think there's real solutions there. Some of the generative AI summaries of all the data, I think that's become real. The letters has become real. So, I mean, I think what's nice is that there is real. Oh yeah, I should have mentioned RCM. A lot of the revenue cycle management stuff, has AI being applied to, maybe more robotic process automation, which is kind of a subset of AI, if you will. Anyway, so we are seeing just a wide variety, which is really nice that it can get past the theory into reality.
Yeah, and let's not forget, one of the interesting trends that I hear people talk about is, their private implementations of generative AI tools, right? Because they recognize that a healthcare organization shouldn't shouldn't use ChatGPT on the public side for their content generation or for the summaries and things, right? Like, so they're having to create their own instances, and so they're having to get into the AI game from a resourcing standpoint. So I'm going to be interested to see how that manifests over the next little while in terms of like hiring that skill or whether they outsource that to somebody or whether these private versions will spin up on all these different platforms. So yeah, it's gonna be a lot of fun. It's gonna be a lot of fun, I think, to see where that topic goes. But but John, were any of the other numbers that were presented, any of the other topics that were increasing or decreasing in terms of health IT was surprising to you?
Yeah, I mean, I think it's interesting, for me that, well, I mean, it's not surprising that cybersecurity was blowing up, right? That's another, not a huge surprise. Cybersecurity has become so popular, although it certainly ebbs and flows, right? Like when there's a breach that's happening, which ironically or kind of miserably, cybersecurity has become a eternal topic, right? That's just become so problematic. So, that's interesting that it's blowing up. The other one for me that I think you highlighted was interoperability was going down, which you highlighted the information blocking QHINs, and maybe that's what it is. There was a bit of hype with the QHINs, the information blocking, and now it's falling off because those are starting to just mature and do things like that. So I think that one was a bit of a surprise that more people aren't talking about it. Interoperability that it's falling off. I would have thought we'd see more headlines as we understand what really is a QHIN and how are they really exchanging data.
Yeah, no, that one was a bit, I guess, disappointing. um, and I think there's lots of mentions of interoperability, but not a lot of articles about interoperability. So I think this, one of the tougher things that our analysis doesn't do is get right into the heart of, maybe they mentioned interoperability in the middle of the article. But certainly from a headline perspective, it's not the subject of a lot of headlines, which is disappointing. Because obviously we want to try and get there, right? But the one for me that stood out was just I thought RCM would be a lot more popular than it was, and it certainly is popular in the sense that it is getting a chunk of the headlines. But I thought just given all the pressures that the healthcare organizations are under, what is happening with change, the application of AI even into RCM, which is kind of an exciting area, I thought we would see a lot more, and we're not.
Yeah, for sure. I mean, and RCM has become so popular and so important to organizations that, but maybe we were just writing about it so much that we got sick of it. Like that's the challenge, right?
That's true. It's also, let's be honest. When you start with the negative topic, that the economy is terrible or that inflation is high, people do get tired of hearing about that, right? So maybe we're tired about hearing the margin problem.
Well, it's not fun to write about either, right? Like it's kind of depressing as well. So
Not to say that we don't enjoy writing about it, right, John? I mean, you and I both like writing about RCM, but just to say in general, there are not as many headlines about RCM related issues.
it's a good point, right? Like if I look at it, I've actually written more about interoperability in RCM in the last year than I have any time before that. So, like it's a little shocking to me that, and maybe that's good for our publication, Healthcare IT Today, that we're doing something slightly different than the rest of the people. But I've certainly written more about those two topics in the last while than I have ever before.
Yeah. So, John, I mean, I think we're just going to continue to cover the topics that we cover, right? You and I just kind of go where the stories go. And we're always interested in cool stories, interesting technologies, and whether that's RCM or whether it's interoperability, almost doesn't matter, right? We just want to connect with cool people doing really interesting things. So, I'm certainly looking forward to more RCM topics. And hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we're discussing the health IT topics that made headlines and other trends in health IT media. So, John, for you, what are the topics that are not showing up in health IT headlines?
Yeah, I mean, it was interesting when you did the survey that there are certain things. I mean, the obvious one is we're tired of talking about COVID-19. Like that was like duh, like I don't think although it's interesting, like even yesterday I was with my wife and she's like, back during the pandemic, and I'm like, are we gonna do this for the rest of our lives? Like telling stories about what it was like during the pandemic, but anyway, it's interesting to see that evolution, right, of coverage. The one that maybe is surprising to me is that we aren't talking about IT infrastructure more. Especially because most of the healthcare organizations that I know are investing big money on moving their EHR to the cloud. Like Epic has finally accepted the cloud, for example. I've been doing a bunch of work with Rackspace and their Epic cloud hosting and the efforts they're doing. And healthcare organizations are really interested in it. They want to get out of the data center business. They want to get out of the desktop support business with virtualization, with VMware, with Dell Technologies, helping them implement this stuff in the cloud and doing it in a secure way. And it turns out that virtual infrastructure is more secure than having a desktop computer there, where, if it's compromised, then you got to replace the hardware, you got to reimage it, whatever. Whereas it's a virtual one, you blow it away, you start a new one, and anyway, the monitoring around these virtual machines is better too. So, I'm surprised that IT infrastructure isn't talked about more. Maybe it's too broad and they can get that at other places. It's not very healthcare specific necessarily. And so they're getting their content other places. And so it's more competitive. I don't know. But yeah, so it's interesting.
Yeah, I mean, and just for those that are listening, we also discovered there were a few topics that were less than 1% of all headlines in healthcare media for the past 3 months, and COVID obviously was one of those. The one that was surprising for me, though, John, was home care. You know, we've been tracking this now for like 3 years, not just like the last 3 months, but 3 years. That topic has never, ever gone above 1%. Maybe 1.5 was the highest at peak, which I find extremely surprising given all the hype, if you will, all the talk about care at home, care outside the four walls of the organization. It just hasn't translated into stories, which to me says we're still experimenting with it. So it may be happening, but it hasn't reached the consciousness level of wanting to do a lot of coverage on it. I think the way it manifests, of course, is RPM, right? Remote patient monitoring. But just I thought that topic would have had a lot more legs to it, given that it is supposedly the future of healthcare, one of the futures of healthcare. So that one, to me, really stood out as, oh, why is this less than 1% of all the headlines?
No, for sure. And you look at all these home health companies that are growing really large, right? But it's interesting. Is there going to be specific home health, technology that they need to implement that we should be writing about that's different, or are they going to just use the same kind of reminder, tools that are used, and the documentation's still going to be an EMR of some sort, right? Like it's not clear that it's so unique that it needs its own tool set. They probably can use the existing tools, so maybe that's part of it too. Or maybe they're just not even using the tools because it's such a different model, right? And they're still not in the paper necessarily, but that they don't have the same requirements as other organizations. So yeah, that is interesting in home care because you see so much investment. And if I were building a healthcare company right now, I'd definitely consider home care because there's so much interest and desire for that type of service. So yeah, I think that's interesting to go. The other one that was maybe not surprising is that's we're not talking about it much is the telehealth one, right? It's just become part of the furniture of the environment now. So it's like, yeah, of course we can do that if we need to. If that's needed, we can add that on. But it's no longer like, oh, we need to push this. The one that was a little tricky for me that I was surprised, there's not more headlines about is social determinants of health. I see that as a very hot topic, right? And a topic that people want to hear about. And there's a lot of people passionate about the efforts to address some of those social determinants of health and all the health equity that's associated with that, and the issues surrounding that. So, and I would have thought that, us as media would want to cover that more because that is something that interests so many people, kind of tugs at the heartstrings a lot of times, right? Which is often makes for a good story. So that one was a little surprising it didn't happen.
Yeah, and I'm wondering though, just on that one in particular, John, I think there's a lot of talk about it. It's certainly a topic of discussion in a lot of conferences we go to. But the fact that it hasn't appeared in the health IT press perhaps indicates that there aren't a lot of technologies that are really trying to solve this problem or that have found a good way to solve this problem. It's a lot of data gathering, a lot of data analytics for sure. That seems to be talked about a lot in the context of SDOH. But I wonder if that's the case as well. It is a topic of conversation, just not in the health IT circles yet because we haven't got a lot of really amazing solutions. I mean, certainly we've seen a few, but I'm talking generally. We haven't cracked the nut yet, so maybe that's why we haven't gotten a lot of coverage.
Yeah, I think we're to the previous point. We're tired of talking about it in theory and acknowledging that it's a problem versus, hey, there's some really good solutions for this that can be applied broadly. There's a few out there that are really working on it. I think, is it called Unitas? I think is the one that united us, that united all these SDOH companies into one organization. I think they've had some success, right? But they kind of consolidated the market in a lot of ways, which was interesting. They acquired and merged with a number of different SDOH companies. So yeah, to your point, maybe there's just not as many out there to cover it that are doing innovative things.
Well, I think a lot of people are maybe doing some things in the background too, right? They maybe aren't ready to talk about it. We do know that a lot of payers are kind of into this space and trying to figure out, by solving, food insecurity, how can that have an impact in terms of hospital visits, and they're certainly obviously very keenly interested in that kind of causality. So I think there is movement. There's something happening in the space. Maybe it's just not at the level of warranting a lot of coverage. So hopefully that'll change over the next few months and into 2025. But
And to
let's
your
get to
point,
the
maybe it's embedded in the EHR or those efforts, right? It's embedded in their population health efforts, their AI efforts, their marketing efforts, so maybe it's a tangential topic rather than the premier topic, right?
It could be very true. Although, like patient experience, I wish it was like the top topic, right? Because SDOH and dealing with that, I think, is near and dear to both our hearts, and it would be nice to have, a lot of coverage for it to drive up more demand and awareness. But it'll happen. I'm confident it'll happen. But John, let's get to a very, very important question. One that caused a little bit of controversy when I presented it at the Sway Health Live event recently. What are your thoughts on the current state of Health IT conference giveaways? Are we going up? Are we going down, John? Are we trending any particular way?
It is interesting to watch, right? And the number one factor for tchotchke is, can I use it? or can I give it to my kid, which is still a form of use, if you will, right? Like, so that is the core question. And you and I have been at too many conferences. Our kids are spoiled with any sort of tchotchkes we've brought back, so it's a high bar for our kids to get value out of a tchotchke. Although it's ironic how many stuffed animals I brought them, and I can still bring them more, and they still take them. So I guess that's why the plushie is the universally happy, because it makes the kid happy, and you can give them as many as they want, and there's so many variety, you can't end with it, right? I was actually surprised that the socks weren't higher on the list of the survey results at Sway Health Live. I thought for sure socks, is the number one giveaway, I'd say, at Health IT conferences when I go around. And we held a customer panel at the event, and two of the CIOs, a current one and a former one, they both were like, the only thing I take is socks. Everything else I don't need. They said maybe a power bank, but how many power banks do you need is the key question there. But one of the CIOs even jokingly said, I haven't worn the same pair of socks in a long time, because he's like, I just pick them up at the conference. I was like, socks seems to be still popular, at least by them.
Yeah, definitely. I mean, we know you and I have spoken to quite a lot of people who make tchotchke, right, in some interviews, and they're all telling us that definitely socks remains very, very popular. Both high quality socks and just sort of lower quality ones that you can just give away everywhere and everywhere. And both have their uses. And although I don't pick up socks anymore, I do know a lot of people who do enjoy them. They're also more subtle, right? They're not in your face. They're sort of you can not hide them, but they're not sort of right. You're not a billboard for the vendor, and I think that's what a lot of people also appreciate, right? It's not a T-shirt or it's not something like that where it's just emblazoned with logos and things potentially. So yeah, I was a bit surprised that stuffed animals is rated that high. I mean, I think to your point, John, there's such a variety of them, and I think very clearly people still grab them. I am a big fan still of like drinkware. I don't know if it's just me. I enjoy a good, water bottle, Yeti mug. Those are my favorite tchotchkes. Wasn't as popular. It was the number 4 on our list at 5% of survey respondents saying that they appreciated that as their giveaway. But yeah, a little bit surprised that socks didn't make the list, and also surprised that we didn't get a lot of giveaways around things like pens. No one likes a pen, even though that's the one thing we give away all the time.
I think they just assume pens are ubiquitous. That's the like everyone has the pens because they're so cheap to give away. I think that's the easy one. Haven't you seen the same thing? I would think you, in your drinkware love and my sock love, right? I still pick up the socks, but I'm more selective, right? Like I look at them and I can tell, one, do I like the color, the design? I like stuff that's a little more flashy, a little more out there, that's going to stand out if I decide to wear them. And I also want to make sure they're comfortable. I want to make sure they're the right length that I like. And so take them and realize, oh crud, these are the tube sock, which to me are the lowest rung of misery when it comes to socks. So those ones get thrown away. But like I guess I still will take the sock, but I'm definitely more selective. I'll look at it and I'll be like, ooh, no, that one's got the ridges. I don't like the ridges. That doesn't work for me. I want the smooth sock that's flexible, that I can get on my feet easy, or it's like, is it too thick or is it too thin, So I don't know. I imagine you've had the same with drinkware. You're like, I want the nice drinkware, not the little cheap $2 bottle, right?
Yeah, I mean, definitely that's a trend that we've talked about in coverage on Sway, right? This is the trend to more higher quality. And we don't mean like you have to give away a Swell bottle all the time, or like the top end Gap style socks, but something where it's not going to fall apart, that is good material, not scratchy, not cheap metal if you're doing the water bottle thing. Yeah, I think people can tell the difference. Certainly if they're a regular conference goer. But even if they're not, I think people will take it and do what you do, John, is like get back to the room and they go, oh, this is one of those ones. It's very thin. It's not going to hold a lot. Or it's not the kind of material that I really like to wear, and they'll just throw it out. So definitely I would say the trend is very true around quality. And yeah, I mean, in terms of a water bottle, I definitely look for ones that have a heavier base because then they don't tip over as easily. We do a lot of traveling, so I'm definitely looking for ones that have a good seal on the cap. And there are certain cap styles that have the real sharp ridge on the bottom. You can tell that those ones don't hold the water in as much. That's what I found over the years. So yeah, those are the little things you look for, as conference veterans. We go around looking for the quality stuff.
It's funny you say that because I actually, I like to put ice in my water bottle because I love cold water. And so I actually need a water bottle with a bigger mouth, right? And it turns out, this is my unofficial, numbers evaluation, but I'd say about 90% of them are the smaller mouth, right? Which is nice when you're drinking, right? I get why they want the smaller one because when you're drinking, that's nice. But I wanted the bigger rim to be able to put the full ice cubes in there. I don't have the machine generated. So, if I had the smaller ones, it probably wouldn't be a bigger deal. But anyway, it turns out no people don't like giving away the big
the big mouth ones. Yes,
yeah.
that's funny. We could probably do a whole episode on just this, right? Shall we deconstruct the ultimate sock giveaway and the ultimate water bottle giveaways?
What it means is we've probably been to too many of these. I actually saw, a couple of good ones actually at Sway Health. The ice pack one. I'm surprised that hasn't shown up because those are pretty useful, right? In your own life, and you can use those. I also love the hacky sack one that was just given out. I like those because you can even juggle them. You can kick them. They're fun to play with your kids. So I was like, I forgot about that one. That was a good one.
There are some really good giveaways. I'm just hoping the next set of giveaways there's some really interesting phone giveaways because after those pop out things over the last 5 years ago, those were super popular. Those little rings that go on the back of the phone. Haven't seen a really good phone accessory in a while, so I'm interested and hopeful that we're going to get another round of those.
Yeah, is the pop socket done? We haven't seen many of those, but that was like the hit for a long time. I saw one that had a gripper that you slide onto your phone that you could either use to stand up or you can use it to hold the phone better. I will see. I wasn't fully convinced that was such a great idea, but it was interesting to see. The other one's the stands, right? The variety of phone stands that are available. There's so many of them out there. It's insane.
Yeah, no, and it's got to be compact, right, for all of us who travel a lot. But that's probably a good place to end it, John. We can just spend, like I said, we can spend all day talking about this very interesting set of topics that we're covering in the media and, of course, the giveaways. So thanks to all of you who tuned into this episode of Healthcare IT Today. For more details about our show, check out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hung along with my friend and health IT collaborator, John Lynn. Thanks for listening and have a great week.